Good morning. This is Dr. Carissa Hines with a quick medical minute. I am in our Old Fashioned Health Network studio this morning, recording a little something for our podcast, and then I'll be going to the radio station for our broadcast for today. But what I wanted to talk about today, the CDC has released new guidelines that give recommendations for what vaccinated persons can do. And so we have that up on the screen. So if you are a vaccinated adult, what they are recommending in terms of being able to go out and be around other people, because that has been the big thrust, right? Mm-hmm. That when can I go and visit my grandparents? When can I go visit my parents? When can I go visit my friends? How can we get together? That has been the big push. And now that we have our vaccination well underway, now the CDC has made these recommendations. And so I was listening to Dr. Walensky, who is the head of the CDC. I hope I pronounced her name correctly. And I was listening to it, and it got a little bit into the weeds for me. And so I figured, I was like, maybe there's somebody else who needs this simplified as to what we can really do, just an easy way to remember. So this graphic is from the CDC. And so they are saying, they're categorizing people, if you're a solid green dot or a solid orange dot or a hollow orange dot or a dotted orange dot, which that already is just doing way too much. Mm-hmm. Way too much. But, it's them, and, this is what we're going to go by. So this is what they are saying, that if you are a vaccinated person and going to visit another vaccinated person, or if you are a vaccinated person going to visit an unvaccinated person that is of low risk, mm-hmm. and see, that's where it gets to, it gets a little confusing, because It's like, who is low risk?
What determines low risk?
I'm going to have to look that up, to be honest with you, because I just felt that it was too, sometimes we can be a little too cerebral.
Right.
In the things, like, I like to keep things simple. Right. So, and then of course, if you are, so you don't have to have any prevention method with that, which means that you can visit your loved ones. You don't have to wear a mask. They are still recommending that you don't do large indoor gatherings, but outdoor gatherings are fine if everybody is vaccinated. Now, here's where it gets a little bit tricky. If you are a vaccinated person and you're visiting a household with someone who is vaccinated and someone who is unvaccinated, y'all, come on.
Who is vaccinated?
So you have a person in the household who is vaccinated and a person who is not vaccinated, but at low risk.
You know what? The one they left out is the one that may have had COVID. I guess they would be low risk.
That's a low risk person. I guess that would be a low risk person. Mm-hmm. Yes. Then they talk about if you are a vaccinated person and you are going to visit someone who is vaccinated and then someone who is unvaccinated but at high risk and not at home. See, who's keeping up with all of this? Like seriously, and I'm not trying to be flip about it.
Right.
But who is really, really keeping up with all of this? So, because I'm me, I decided to make it simple for everybody. So
please,
if I could have the next slide, or the green slide.
Green slide, okay. By the way, today is Dr. Hines' birthday, y'all.
It is my birthday.
Green slide, so what's
okay, so here it is. Let's just make it easy, because I'm going to just break this down for you in terms of green, yellow, and red. Mm-hmm. So everybody understands that, because most of us who are adults drive, or you've at least seen a stoplight, right?
Right.
So you can remember this. So if you are a vaccinated person and you want to visit a vaccinated person, that is a green.
Okay.
Green means go.
Green means go.
That is, you are in the clear to do that.
Okay.
And you can do that without wearing a mask.
Okay.
And so the next one is going to be our yellow.
Okay, let's see.
There we go.
Okay.
So yellow means caution.
Okay.
Right?
Okay.
So if you are a vaccinated person and you are visiting an unvaccinated person, mm-hmm. you should still use caution, meaning that you should not have large gatherings indoors. You should probably still wear your mask, because even though you are vaccinated, you still can be a carrier for the virus, and you can transmit the virus to an unvaccinated person. Right? So you can still infect people.
Okay.
Right. So if you're vaccinated, you're visiting somebody who has not been vaccinated, you still want to wear your mask, you want to wash your hands, you want to do the
because
distance.
you can infect them.
Because you can infect them.
Because you've taken the shot, but you still can carry it. Oh, wow.
Because the vaccine only protects you.
Gotcha.
It doesn't protect you from passing it on to other people.
Gotcha.
Right.
Okay.
So that's you still want to use caution.
Okay.
Right.
Okay.
So now the next.
Okay.
And I'm to let y'all guess, the next one is red, right? So if you are an unvaccinated person and you want to visit an unvaccinated person, that is a no.
Wow.
You still should shelter in place.
So we can't go to the club?
No, please don't.
Oh, okay.
Yeah, I know we just had All-Star Weekend here. Yeah.
Off the chain. This is Atlanta. We never shut down, right?
This is true.
Okay.
I mean, and Atlanta's a fabulous city, and I understand the draw of why people want to come.
Right.
I was a little bit dismayed that, there were still activities. Not shocked, but just like, come on, y'all. Because we're just so close, right?
Yeah.
By May, the estimates is that most adults will be vaccinated in this country. And we are actually making really, really great strides. So as of today, I think 16% of the population has received at least one shot of vaccination. Okay. And about 9% of the population has been fully vaccinated. So they have either received 2 shots of the Pfizer, BioNTech, or Moderna, or 1 shot of Johnson & Johnson.
Okay.
So we're on the way.
Okay.
Right? And, the Biden administration has just purchased another 100 million doses of vaccine. So the estimate is that by the end of May, that every adult in this country that wants to be vaccinated can be vaccinated.
Okay.
So, it's already March. It's the middle of March, for Christ's sakes.
Right.
We're there.
We can start
we just got to hang on just a little while longer. And then, we get to herd immunity. So even for people who are, I don't like to say vaccine hesitant.
Reluctant?
Well, I don't know. I don't even know that I want to say reluctant.
Crazy?
No, definitely don't want to say that.
Oh, okay.
But, there's some people who are still deliberating.
Okay.
There are some people who are still trying to figure it out.
Right.
And we have to allow them space and grace.
Right.
To do that.
Right.
Some people are still saying they want to see more data. I'm still getting a lot of questions, even though I've been vaccinated for, about 6 weeks now?
Right.
Something like that, almost 2 months.
I know people are asking you, are you feeling any kind of way?
Exactly. People are still asking, have you had any effects, which I have not.
Okay.
How are you feeling? How was it? People are still asking, and people are still curious. People are still scared.
Right.
And so we have to allow space for that. So I don't like those labels of vaccine hesitancy, particularly in the African American community, because as we discussed before, there is plenty of reason for people of color to be, a little bit hesitant about getting it, or to take their time to deliberate. So, so I don't have a problem with that.
Right.
What I want people to do is just to be safe while they are deliberating.
Okay.
So, I don't care what your governor says. You cannot take your mask off and go hang out in the bar.
Oh, well.
You can't. No.
So let me ask you, what about, okay, so if you've already had the virus, like I've wondered if I've already had the virus, my regular primary doctor's like, okay, I'm not worried about you trying to get this shot right away because you tend to have the antibiotics in your body. Tend to was the word.
Right.
Do you tell those people not necessarily not to take the vaccine, but
everybody should.
Okay.
Even if you've had it.
Okay.
And it is for the very reason that we don't know about immunity. Like, it's not concrete.
Okay.
We assume that you will have some immunity, but we can't tell you how long that's going to last.
Okay.
So, you want to just make sure, just be double covered.
Okay.
Because there are instances, it only happens in about 1% of the cases.
Okay.
But there are cases of someone with a second COVID infection.
Yeah, I talked to a young lady that she said she had it the first time. It was horrible. The second time, she said it was like, okay, well, it was a more of a mild type of situation. Mm-hmm. So, and then I know people that was like, well, I've had it already. I'm just going to roll the dice.
And, and that's a risk that people take.
Okay.
But, it's like with everything, right?
Right.
There's some people who still don't wear seatbelts. and they drive.
That's a good analogy.
There are people who have, sexual encounters and they don't use protection.
Right.
So that whole thing of taking risk and people taking risks, that's just human nature, that some people are going to continue to take that risk
right
until it catches them.
Yeah.
And hopefully it doesn't, but you just never know. But
Okay.
that's human nature. So that is all that I have to share for today. So just remember, green, yellow, red. Green is safe. You can go if you both have been vaccinated. Yellow, you want to use caution if you are vaccinated and you want to visit an unvaccinated person. And if both of you are unvaccinated, you definitely want to continue to social distance. I would not recommend that vaccination. I would not recommend that visit. The CDC has not made any recommendations about travel as of yet. But what I would say is to look at where you're coming from and look at where you are going. Because even though, I'm seeing some amazing flight deals and I love to travel and I'm just like ready to get on a plane and go. However, you have to consider if you get sick while you're there, what are the medical resources available to you? Because being evacuated from a country to come back home can be very, very expensive.
Yep, that's what I was going to ask. Well, they can almost keep you over there. It's like you can't get on the plane for 15 days, right? Or something like that.
This is very true.
Wow, yeah.
Or even longer. So, if you're really, really sick, now let's just say, not just becoming positive, but let's say you really, really get sick, you could be stuck in the hospital in another country for weeks.
I would just like to tell my people, y'all know who I'm talking about. We don't travel with an overflow of money. Them car notes probably going to be due while you're over there, so you might want to try to.
Well, all of your notes. So, just to be evacuated, it is, so I had to do this with a patient, not for, well, actually it was for COVID. We were trying to get this patient medevac, so with a helicopter, and the insurance wasn't going to cover it. And the medevac company came back to us and said, it's $50,000. And if your patient wants to pay that, we'll be happy to come and pick him up.
And they need a check up front, I'm sure.
Oh, yes. Yes. There's no payment plan for that.
I hope they wouldn't expect a tip.
That's it for today. I will see y'all in a few minutes with Medical Minutes with Dr. Carissa on Real 1100 AM. Have a great day, y'all.